The theme for this year's Global Forum for Health Research, currently underway in Cape Town, Beyond Aid, it focuses on research and innovation as key drivers for health in developing economies. CNBC Africa's Thomas Maree spoke to South African Deputy Health Minister Gwen Malegwale Ramokgopa about the burdens on the local health sector and government's collaboration with other departments that's in improving health outcomes.
The key issues that are discussed at the forum are related to the whole theme of Beyond Aid. And it's about how countries should look at leveraging investment in science, research and technology to improve the health of their populations, particularly in developing countries. It is important that the whole concept of science, research and technology is demystified to enable those countries that are like ours, which are developing countries, to really continuously have an inquiring mind and inculcate this even amongst our young people, and to look always at better and new ways of advancing human development, particularly in the health sector. Just to give examples, for instance, we can use the cell phone technology, which has penetrated even in rural and remote areas, to send through messages on health, to remind people to take medication, especially in TB treatment, which is very complex, to also remind people to come to clinics for antenatal care and all that. But also on the other hand, for us who have a burden on HIV, AIDS and TB as well, we must also look at better ways of advancing the treatment regimes. We have a plethora of tablets that people take now, for instance for TB. We are doing research with some pharmaceutical industries to look at single dose or single pills to converge that into single doses. We have invested in the gene experts with the support of the Global Fund, and partnerships here are important, to reduce the diagnosis of TB from 6 weeks to only 2 hours. So these are the possibilities that are available for us in developing countries and also for poorer countries to come with solutions that will improve the health of people.
That's amazing to hear. Deputy Minister, what would you say is the biggest drain on the health sector in South Africa's economy? And you did touch on it, and is it costing us millions or billions of rands?
I may not have a direct figure now, but the cost of HIV, AIDS and TB on the health sector is really, really phenomenal. It has to do with the impact on children that are HIV positive. It's also a future cost. It has to do with the cost of the working force in terms of human capital loss there, in productivity loss. It also has to do with the huge resources that the health sector has to spend in treatment. Just this in 1 year, for instance, we purchased antiretrovirals to a tune of over 4 billion rands. So the cost is quite huge. So investing in more affordable technologies and also in prevention interventions is very key. That is why we are investing in our scientists participating in a search for a vaccine against HIV/AIDS.
A moment in your speech on collaboration that the Department of Health is doing with, say, the Department of Communication and the Department of Sports to improve overall health. Can you briefly just tell me more about that quickly?
The health sector cannot work in a silo to achieve equity and development. We are working with, for instance, the Department of Science and Technology to look at developing and manufacturing technologies that we can manufacture treatment and drugs, especially antiretrovirals, because South Africa consumes almost 25% of the global antiretroviral treatment globally. So we believe it's important that we build that capacity to also develop that technology in pharmaceuticals and manufacturing. Secondly, we are working with the Department of Education to launch, which will be done later this year, the school health program. As important education is, equally health is important in investing in human development. The Department of Social Development, we're working with them in terms of reducing substance abuse and also improving the quality of life of children, the under 6, which is very important also for cognitive development. And with the burden of the non-communicable diseases increasing worldwide, including in our country, we're also working with the Ministry of Sports and Recreation to get South Africa moving. And that is very important as a preventative measure for non-communicable diseases. So multi-sectoral collaboration is important. Collaboration with development partners in a synergetic manner is very important, and investment in science, research and technology is critical to find better and new ways of improving the lives of our people.